what in terms of distribution and delivery of the vaccine would we say were learned from our experience with the COVID vaccine? And also, how can those lessons be inculcated to improve uptake of the malaria vaccine?
I think one thing we learned from COVID specifically was, number one, you have to get all the stakeholders involved. So before you start any vaccine program, it's important to work with whether it's the government stakeholders, the donors who are likely to be supporting a lot of this effort, also to work with the National Primary Healthcare Development Agency, because it's important that as part of introducing vaccines into the country, that we work with those who have already set up the sector. So in other words, the Primary Healthcare Development Agency. No matter how you look at it, primary healthcare is responsible for vaccination. And so you don't want to start developing new schemes or new ways of getting vaccines out when there's already a fairly well set up system to get these things out. So number one, first of all, so you work with Primary Healthcare Development Agency, introduce it into the routine schedule. Already, we have vaccination going on nationwide for polio, for BCG, for tuberculosis, for pertussis, for rotavirus, for pentavalent, all sorts of vaccines. So it's best to introduce it into the schedule through these various primary healthcare development agencies that exist all over the country, estimated to be over 30,000. And so if we work through that system, we also work through the logistic system that has been set up so that we don't start a whole new system working through and trying to develop new wheels in the new cogs in the wheel that will cause its own challenge. I think the next thing we also have to do is awareness. So making sure people are aware that you can get this vaccine and where. So in other words, primary healthcare centers. And when I talk about primary healthcare centers, I'm talking about both public and private. Often we tend to look at only the public sector, when we can see from some of the data, I was actually quite impressed with some of the data that was presented here, where more people actually go to a pharmacy or to a patent and proprietary medicine vendor for treatment of malaria than go to the hospital. 43% compared to 40%. So you can see that there's actually a place where people get information. And so provide that information to where people go, which is both public or private sector. So I think that's really important that we don't focus only on the public sector when we're distributing these vaccines. I remember during COVID, people received their vaccine in the pharmacy. You could go to the pharmacy, the Pharmacy Council of Nigeria, they work to train pharmacists to be able to provide these vaccines there. So what's important is where the people go is where we should take the vaccine. I think the other thing that's important is the logistic system. All vaccines need a cold chain of some sort. So ensuring that the reason why we had a lot of expired vaccines is that, and actually Society for Public Health, we helped MKTK to distribute. For the ones who were asked to distribute to the states, they had just like a month left. So by the time they move from the state stores to the PHCs, they have maybe 2 weeks left. And of course, no government, like NAFDAC, is going to distribute expired vaccines. So the setting up the right logistic system, whether you're going to use the public sector logistic system or you're going to work with private sector, third-party logisticians who can assist, get the vaccine to the people in time so that we're able to work closely with the information is going out, the vaccines are there, they have a sufficient timeline to be able to provide it to people so that we don't end up having expired vaccines. No donor, no government wants to have a situation where, because the vaccines have expired, all the money that they've had has wasted. So we must work with various things. So I've talked about awareness, I've talked about logistics, I've talked about working in a sustainable system, so we don't set up new systems. We do vaccinations all the time. Let's ensure we work within the systems that we have. And then one thing I also like to say, whether it's public or private, is the sort that we ensure that where people go is where the vaccines are provided.